Somebody dropped a candy here. Oh, where's my drink? There we go. Well, good afternoon, everyone. I'm very pleased to be here. And we all know that we do a lot of Are you giving away candy? I have something better. You can go to the booth, you can get the Aethern. Aethern, yes. So it's very important that whatever procedure that we're doing in the office, that when people go home, they have something to take with them that's going to enhance their procedure. So we all know about the value of creams, but I think that the value of taking an oral supplement has been debated. It's been more explored in terms of hair growth, but in terms of quality of the skin, I think there's a lot of room. So we all know with skin aging, and this has been discussed, that there's a decrease in hydration, obviously a decrease in collagen content, whether it's 1, 3, and 7, and an increase in dyspigmentation, and also the decrease in elasticity that we see both from our genetics as well as from UV exposure. So in terms of treating the aging skin, in the office we use a combination of lasers and radiofrequency devices, peels, microneedling. We use injectables, anything from neurotoxins to different types of fillers to the threads or sutures. Radiofrequency devices, of course, of different types, both the ones that are in a microneedle array as well as just an external. So at home, topical skincare, of course, is very important, as well as sun protection. And this whole session, you've heard of all the different varieties of types of skincare and what molecules they're targeting. In terms of oral nutraceuticals, this I think is a fairly new, undeveloped area that needs to be expanded. And so we have been working in my office with this company, Aethern, to look at the kind of results that we can get in terms of taking an everyday nutraceutical. Because it's a little bit difficult and it requires a lot of patient education to understand that everything needs to be done every day. So in the United States, there's very much of okay, well, if we don't see a result in 48 hours, then it's not happening. So it's a very American problem, I think, whereas knowing that you have to do something on the long term in terms of preventing and treating aging is very important. So what kind of components would you look for in an effective nutraceutical? Well, one would be antioxidants, and antioxidants certainly help reduce free radical formation, which occurs both from ultraviolet exposure as well as just metabolism. Just eating every day is going to produce free radicals and oxidize cell membranes. Peptides have been shown to stimulate collagen production, elastin production, minerals. So what are the three main categories? As I've mentioned already, hydration. So we want to increase the content of hyaluronic acid in the skin. It's a natural component in the skin that holds water, of course. And so when it's cross-linked, it's in the form of most of the fillers that we currently use. And uncross-linked, it can lead to an instant plumping when applied externally, but adding something internally that can help increase the hyaluronic acid content of the skin would seem to be as very valuable. So firmness, of course, is separate from elasticity, and firmness is directly related to the collagen content in the skin. And radiance, that whole concept of the skin reflecting, is very important for a youthful, healthy appearance. And in fact, you can have wrinkles, but if you have radiance, those wrinkles are much less apparent. And people tend to view skin as healthy based on the amount of radiance that's there. So oral antioxidants can help protect against ultraviolet-induced skin damage and improve the quality, youthfulness, and overall beauty of the skin. I think it's really judged on radiance. So what's in Aethern? It's a proprietary formula, and it certainly reinforces all the active ingredients. And in order to get all of the content of this number of pills here, it's about 23 pills, it's all packaged into a single oral, a single drinkable dose, individual package per day. So what are the key ingredients? Hyaluronic acid is produced by bacterial fermentation. There's also bioactive collagen peptides, type 1 collagen, that's there. And the optimal molecular size allows absorption by the body. There's also astaxanthin, which is one of the most potent antioxidants that's there. And it's derived from plants, and it's much more potent than a synthetic astaxanthin. In addition, there's bamboo extract silicone, which improves the texture of the skin. And these are all extracted from various plants. So Mediterranean polyphenols from pine bark, grape syrup, and this has a nice mixture of antioxidants with anti-inflammatory and skin-protecting properties. And other key ingredients are magnesium, and we all know how important that is for cellular health and metabolism, beta-carotene, zinc, calcium, vitamin E, lutein, selenium, and there, in addition, are some natural flavors. So it's a very nice combination. So, going back to Leon's idea of trying to have some more evidence-based medicine, the compound was subjected to a trial done by Zoe Drelos, looking at a double-blind placebo-controlled. So what was interesting about the study is that it was compared against another oral liquid supplement. There were 70 subjects aged 40 to 59, and they were assessed over the course of 12 weeks. Once daily, it's a once daily, it's not twice, once daily nutritional supplement, and the different parameters that were evaluated were skin hydration, firmness, and radiance. So the data, so the patients were evaluated at baseline, of course, week 4, 8, and 12, so over a 3-month period. And efficacy, the subjects they also did self-evaluation at the same time points, baseline, week 4, 8, and 12. So the tests that were done were corneometry, which is a pin probe, and you get an instantaneous reading of skin hydration on both the face and upper arm, because the face, and everybody had a standard facial cream that they were using and a sunscreen, but then you have to wonder, like, is it going to be taken up more preferentially in one area of the body versus another? And so it was a good idea to test both the face and the upper arm. And elastometry, the same thing. It was tested both used to assess skin elasticity on both the face and the upper arm. And so the results at week 12, and it really, as I said, when people start taking something or using a cream, you always have to remind them that it's going to take a little time to work. It's not something that's an instant result. So by week 12, the investigator efficacy showed that there was a significant improvement in hydration, and it was statistically significant in both hydration, in all of the three: hydration, firmness, and radiance. And corneometry of the face and arm, 53% improvement in face hydration at week 8. Elastometry in face and arm, 29% improvement in face elasticity, 8% in arm elasticity. And so there was a preferential, there was a little bit bigger change in the skin on the face in that period of time, and it's a little bit unclear if it was metabolically more active or it influenced the metabolism more preferentially in the face. But overall, that after 12 weeks, this amount of improvement, this is and in fact, Zoe Drelos was surprised by how significant these changes were in radiance, elasticity, and in hydration. It was pretty dramatic. So here you can see a few clinical pictures, and this woman has a little bit of rosacea, and in fact, we were surprised to see that her rosacea, the erythematose, just really mostly the erythema, had some significant improvement. And that was something that wasn't really captured. It was just more of a clinical observation in this particular patient. And in this patient, you can see an improvement in the radiance here. There's a little bit more of a glow in the skin. And this is after 8 weeks. And here, in this patient, this woman's hands, her nails changed color. That was very interesting. But the quality of the skin on her hands also improved. So in conclusion, oral supplementation clinically improved in 3 main categories of skin aging as compared to a control supplement. So I really believe, and we're doing this in my office as well, that oral supplements have a significant part in a comprehensive anti-aging skincare program. And so future studies, of course, are always indicated to move us up to an A in evidence-based medicine for this topic. Thank you very much.